cough medicine. We've all taken it for a cold or cough to help us feel better. But did you know that some teens intentionally abuse large amounts of over-the-counter cough medicine? Sometimes as much as 25 to 50 times the recommended dose to get high. And it isn't to get drunk as some parents might think. They're abusing the active ingredient dextromethorphan, or DXM, which can be found in over 100 over-the-counter cough and cold medicines. In fact, according to a recent study, an estimated 1 in 10 teens report having abused over-the-counter cough medicines to get high. And 1 in 5 teens have abused a prescription drug to get high, earning them the name Generation RX.
Why are kids turning to medicines to get high? Well, researchers have identified 2 key factors driving this trend. First, there's a misperception that abusing prescription or over-the-counter medicines is safer than illicit street drugs. Secondly, these medicines are easy to access, whether it's through our own medicine cabinets at home, the internet, or at a local drugstore. There could be a third factor as well. Parents just aren't aware that teens are abusing these medicines, and so are not addressing this abuse with their teens. Remember, if kids aren't hearing about it from the parents, they are likely hearing about it somewhere else.
So, why should you be concerned? Well, for starters, abusing cough medicines can be just as dangerous as abusing illegal drugs. While safe when used according to label directions, when abused, DXM can be dangerous. Abusing DXM can cause delusions, panic attacks, vomiting, high blood pressure, a rapid heartbeat, fever, headaches, and even loss of consciousness. In addition, what a lot of young people don't realize is that many cough medicines contain other ingredients, like acetaminophen. In these cases, if a teen is taking 25 to 50 times the recommended dose of the cough medication, he is also unknowingly taking a huge amount of the other ingredients. That can cause serious damage to the body. And if dextromethorphan is abused with alcohol or illegal drugs or other medications, the side effects can be much worse. Parents, we really need to be present in our kids' lives and listen to them. And keep in mind, research shows teens are half as likely to abuse drugs if you have regular conversations with them.
If you wanted to hide something from your parents or teachers, what would you do? I'd give it a code name. That's what some teens do to hide their cough medicine abuse. Some of the words teens use for dextromethorphan are Dex, DXM, Robo, Triple C's or CCC, Skittles, syrup, or tussin. Terms used by teens when talking about abusing cough medicine include robo-tripping, robo-fizzing, smurfing, and skittling. But these code names are just one part of the medicine abuse subculture. Don't believe me? Just search robo-tripping on YouTube and you'll get a glimpse into this scary world. In fact, the internet is full of websites and videos that promote this dangerous behavior, with some teens posting themselves while high. There may be little that can be done to control what's on the internet, but there is a lot that can be done to counter what's on there.
We can all be part of the solution in stopping medicine abuse, beginning with parents and community leaders who have a critical role to play. Educate yourself about cough medicine abuse and share this information with others. Talk to your child about the dangers of OTC and prescription medicine abuse. Safeguard your medicine cabinet. Know what medicines you have and how much medication is in each package or bottle. Monitor your child or teen's internet use. Be on the lookout for signs that your child or their friends are abusing OTC or prescription medicines.
The retail community is equally important. Become diligent observers in your store. Educate employees and customers about this trend. Provide materials about this problem at pharmacy counters and checkout. Work with loss prevention experts to identify in-store problems like thefts of cough medicines and address them. And be sure to partner with your local coalition. Law enforcement can also help by being aware of the problem and looking out for parties where teens share each other's prescription and over-the-counter drugs, often known as farming parties. Teachers can do their part by being watchful for signs of medicine abuse among students and by including over-the-counter medicine abuse in their school's drug prevention unit. Even doctors and nurses have a role to play. They can educate parents, young people, and other caregivers about taking medications as directed, and they can ask their patients direct questions about any OTC medicine use or abuse. Those of us who work in the community as drug prevention leaders can help by getting the message out to parents and other adults. But first, take a hard look at your community and ask yourself, where are youth getting these medicines? And finally, are you tracking medicine abuse in your community?
So remember, you can do something about this. Whether you're a community leader, a police officer, or a parent, there's a role for you to play. But you've got to act now. Visit stopmedicineabuse.org for more information.